With international tourism and trade growing, new infectious diseases and variants from foreign countries are threatening public health even more frequently. In addition, infectious diseases such as tuberculosis, zoonotic diseases, and antibiotic-resistant bacteria are challenges that we have to overcome. Since 2019, COVID-19 has brought all organizations around the world to a standstill and affected people's day-to-day life with enormous sacrifices being made. In this regard, an institute specialized for infectious disease research is essential to actively respond to those infectious disease challenges. Infectious disease research requires a tremendous amount of time and human resources throughout the entire research process, making companies that have to run profitable business hesitate to jump into this field. With the aim to protect health of our citizens and make human beings and the future generation free from infectious disease, the Korean National Institute of Health, KNIH, established and has operated the National Institute of Infectious Diseases. We are spearheading research on infectious prevention and response at the national level. As a control tower of national infectious disease research, the National Institute of Infectious Diseases designs and manages infectious disease R&D strategy to ensure investment efficiency and research effectiveness. In order to secure core technologies to overcome and manage infectious disease, we conduct and support the entire process of research, ranging from basic research, diagnostics, vaccines to treatment development. We are working hard to develop technology through public-private cooperation to meet the need of disease prevent and control sites and establish new treatment methods based on clinical research. We are also establishing a joint research platform that connects international infectious disease research institutes, while strengthening collaboration among various research institutes in industry, academia, research, and hospitals to produce excellent outcomes of research. The National Institute of Infectious Diseases conducts a variety of infectious disease research through the following 3 affiliated research centers: the Center for Emerging Virus Research, the Center for Infectious Disease Research, and the Center for Vaccine Research. First, the Center for Emerging Virus Research takes the lead in establishment of a national safety net by developing technologies for diagnosis, treatment, and control of new and emerging infectious disease such as COVID-19 and acute and chronic viral infectious disease, including tuberculosis, AIDS, and hepatitis. To this end, we are developing medicines for viral infectious disease and an immunity substance platform, establishing standardized technologies for efficacy assessment of treatment immunity candidate substances, while conducting research to support clinic-based rapid efficacy assessment on clinical basis. Second, the Center for Infectious Disease Research helps alleviate a disease burden by developing technologies for early detection and treatment of acute and chronic bacterial infectious diseases, including tuberculosis, bacterial zoonosis, and antimicrobial resistant bacteria. For this, we are working on development and commercialization of candidate substances for diagnosis and treatment, research on resistance-based transmission control, and establishment of infrastructure for the use of pathogen biological information and pathogen resources. Finally, the Center for Vaccine Research, as an institute responsible for national vaccine development, establishes a one-stop system, ranging from public vaccine R&D policy development, basic study to commercialization support, while securing national strategic vaccines through enhanced public-private cooperation. Furthermore, we support clinical trial sample analysis conducted by domestic vaccine manufacturers to develop and secure vaccines rapidly. The National Institute of Infectious Diseases will strive to ensure vaccine independence and establish a global vaccine hub strengthening our national health safety net. The National Institute of Infectious Diseases, equipped with advanced research facilities, research equipment, and resources, is conducting research on infectious disease and supporting research-related activities done by Korean companies and researchers. The Center for Vaccine Research of the National Institute of Infectious Diseases is operating BL2, BL3 laboratories, supporting efficacy assessment and clinical trials. We allow the Korean ordinary people to use facilities and equipment of laboratories. In addition, we are working to secure, manage, distribute, and use pathogens as resources by building a pathogen-related network at home and abroad through the National Culture Collection for Pathogens. The National Institute of Infectious Diseases will take initiative in creating the environment necessary for infectious disease research and further promoting clinical trials by expanding infrastructure and encouraging the use of facilities and resources.
국립감염병연구소는 국민 건강을 위협하는 감염병에 대한 치료제 및 백신 개발을 주도하는 컨트롤 타워로 발전하고 있습니다. 치료제 백신 발굴뿐 아니라 연구 개발 성과의 실용화 및 임상시험 지원에도 많은 노력을 기울이겠습니다. 이를 위해 국가감염병 전략 수립, 핵심 기술 개발 및 실용화, 민관 협력을 통한 임상 연계, 국제 공조 등을 체계적으로 추진하여 연구 개발 역량을 높일 것입니다. 국내 치료제 개발 제약사, 백신 개발사들이 다양한 지식재산과 기술을 바탕으로 대한민국 자체 치료제 백신을 개발할 수 있도록 국립감염병연구소가 핵심적인 역할을 하겠습니다.
Even at this moment, the National Institute of Infectious Diseases are making its utmost efforts to develop better preventative measures and medicines to have people free from infectious diseases, our invisible enemy that is threatening us. The National Institute of Infectious Diseases, responsible for building a healthier future of the world, going beyond Korea. Building healthier Korea is our happiness.